guys, welcome to That Lady Miss Betty. Today I have here with me Pilar Charles. Pilar is a recent RN graduate from LCC in Lansing, Michigan. That's Lansing Community College in Lansing, Michigan. She graduated Magna Cum Laude, and she was also bestowed the Florence Nightingale Award. So I am so very proud of Pilar, and I wanted her to appear on Betty's channel because Betty was her first caregiving job, and I wanted her to share with you her experience. And so let's just go right to that. Pilar, congratulations.
Thank you.
Absolutely. Can you please tell us and tell our viewers how we met? How did you go about finding your first caregiving job?
My favorite people. Okay, so during high school, I was able to receive my patient care technician certification. So as soon as I got that, I was like, we're getting into the healthcare fields. I've been waiting for this moment for forever. Let's do it. So I knew that...
and let me hold you right there.
Yes.
Because ironically, Pilar went to the Wilson Talent Center in Mason, Michigan, formerly known as the Capital Area Career Center, where Betty was the first African-American cosmetology instructor. So that is one of the parallels that we have in this relationship, everyone. So I just wanted to interject that.
Yes, that's
point of interest. Yes.
So crazy.
Yes.
But yes, so I got my patient care tech certification, and so my search started immediately. At that time, I was working at a restaurant. That's not what I wanted to do whatsoever. So I was searching around. I knew that I wanted to go more the home health care route because I wanted to be a lot more involved with my patients and have more of an intimate connection with them. After doing clinicals at the hospital, I was like, I don't know if I'm ready for this yet. I want to be able to have more time with my patient to make sure that I'm genuinely giving them the care that they deserve. So that's when I started looking into the home care route. So I was looking on Indeed, wasn't finding nothing. Was talking around to people, wasn't getting anything. So then finally my mom was like, why don't you just look on like our neighborhood group and go from there. I'm like, you know what, actually that's really smart.
And that was called
Next Door.
Yes.
I wanted to call it Glass Door for some reason, but yeah, so I looked on Next Door, which is our community group, and at the time Miss Ann was working for Shawn, and she was doing the behind the scenes for her in order to get employees in to work with Miss Betty. So I saw that, and not even realizing that they literally lived up the street and around the corner from us. So I got to speak with Miss Ann for a while. She loved hearing what my journey was, my recent attaining of my patient care tech license. So I spoke with her. She had me come in to meet Shawn and Miss Betty. And still, like, initially that interaction was, it's still so funny to us. So when I first came in, it was a young gentleman and his wife that was working here with Shawn. So I didn't realize who they were, and I'm just like, oh, like, hey, I thought I was working with a daughter and mom. So just like, I was just like, okay, what's going on? And then we were actually like in the kitchen for a little while, and so I'm just sitting there like, okay, so are we gonna meet them? Like, what's happening here? So eventually Shawn like called down to me, and she came downstairs, met me, and then she had me come up to meet Miss Betty, and literally from there we just hit it off. Still to this day I cannot get over the way that Miss Betty greeted me. I actually lost my grandmother when I was really young, and her name was Betty also. And one of the things that my grandma would do is that when we were coming to the house, you better not hug her, and if you did, she was patting you on the butt like, what are you doing? And that is actually the way that Miss Betty greeted me also. She patted me on my butt and looked up at me like, who is this girl? So from that moment, that's still one of like my most favorite memories with her. It's just like, not only is this beautiful woman's name the same as my grandmother's, but I also was able to see characteristics in her that I also have for my grandma. So it's like almost as if she was here too, and literally just one of the most like special experiences that I've ever had. You know, going into the medical field, they always tell you not to get going into the medical field, they always tell you not to get attached to the people that you work with, but honestly, it was like impossible not to get close to this family. Just working with Betty and her being my first patient, I was able to learn so much from her and Shawn, as far as just genuinely taking care of your patient, looking at them as a whole, and realizing that there's so much that goes into properly caring for them, and just taking the time to really get to know who they are as a person as well as their family at all aids into, you know, providing them the best care. I had the best dance moments with her when I was sitting down doing her hair and her makeup with her. That's the moments that I had the most lucidity with her and was able to look into her eyes and know that she was genuinely seeing me, and that we got to share those special moments together and talk. Working alongside Shawn and picking her brain, and just realizing how intelligent she is and how much that she was able to learn, not only for Betty's care but also for herself, and me being able to like take those tools that she's given me to like also like implement those within my life as well as family and friends too. So yes, this was my first patient that I ever had, but honestly they became family, and still to this day those tools that I've learned from the both of these beautiful women I still carry on with while I was in nursing school, and I'll continue to do that as I step into my journey as a new grad nurse.
Just an amazing, so many amazing parallels, Pilar. And your grandmother, Betty, was that your father's mother or your mother's mother?
It was my mom's mom.
That was your mom's mom. Just amazing. Well, Capital Area Career Center, living in the same neighborhood, grandmother, the same name,
same characteristics.
I mean, oh my gosh, and just a glamour girl, and just oh my gosh, just heaven sent. No doubt about it. Post graduating from nursing school, I just wanted to have you on to share what some of your favorite things were that we included in Betty's care plan that have been substantiated by what you've learned in nursing school as valuable.
So I think some of my most favorite things that we did for Betty's care, I actually spoke to it a little bit ago, is the importance and value of tending to her emotional care that you had us do. And when I speak to that, I mean by taking the time to make sure that every day, there was literally not a day that I can remember that Betty was not bathed, moisturized, hair done, makeup done, the whole 9, to make sure that not only were we tending to, yes, her physical needs that she needed, but also her emotional care that she needed as well. You know, every day we go throughout, like, okay, we take a shower, we brush our teeth, we wash our face, we moisturize, and that's just part of our normal routine. But when you become ill and you can no longer do those things for yourself, you realize how important those things actually are and how much of a difference they actually make you feel. And I love that that was a priority for her. Like I was saying, during that time of doing her makeup, her in the bathtub, doing her hair, that was the time that I felt like I was able to get the most conversation out of her. I feel like I was able to see so much of her personality, and just to share that moment with her and make her feel good, like fresh and clean. I got my makeup done and my hair is done. Like, I'm ready to go throughout the day. Like, nobody can tell me nothing. Despite all the other stuff that's going on, I look good, I feel good, and we're going to take this day on one step at a time. So I love that that was always a priority. And whether we were short-staffed or not, we were gonna at least make sure that Betty was cleaned up, she was moisturized, and that we had her feeling the best that we could make her feel. And I think that speaks monuments to how important it is to make sure you're caring for your patients, your family, your loved ones to their entirety, not just whatever it is that they've been diagnosed with. So that was one of my favorite things that we did. I also loved the importance of the entertainment and the physicality that we did for Betty, whether it was dancing, we were walking at the mall, we were walking outside. It's so important to make sure that you're getting your body moving and learning what I've learned in nursing school. It's important to get your body moving, because when you're stagnant, that's when pneumonia happens, that's when other issues happen. As you get older, your bones lose the calcium that they need, so they become brittle. So doing all those things, we had Betty in the kitchen with us doing chores, she was mopping with us. So all of that moving your body, making sure you're getting muscles and your bones moving, that all plays a role into making sure that you don't get pneumonia, that you're tending to your muscles and your bones to help keep them strong, because as you get older, that is a natural thing that happens, and by moving your body, it helps with those kinds of things.
So when patients are seated, which happens a lot, I don't think many people know that that is a part of setting people up to develop pneumonia. What is it about sitting that causes the body to be more predisposed to developing pneumonia?
So with our bodies, they're meant to move. So when we're moving, your lungs are working more, your blood is perfusing more to get throughout the rest of your body. But when you're just sitting, and when I say sitting, I mean like laying down, because we do get our patients up to actually sit, and that is good for them. It's a part of the moving aspect. But when you're just laying down, you're not moving, you're not getting blood circulating, you're not making your lungs expand the way that they should. They get wet. What loves wet, dark places? Bacteria. So when you're not allowing your lungs to properly expand in the way that they need to in order to get the air in there, in order to make them move, you're setting your body up to literally be a breeding ground for infections. And that's where we get pneumonia from. That's where patients get blood clots from, because the blood isn't moving properly. So it is so important, if you are able to get up and you have the help in order to get your patients up or to get your loved ones up, you have to get them up. You need to get them up and moving, even if it's for an hour. Like at least a few times a day, they need to be getting up and moving, so that their lungs can fully expand the way that they're supposed to, and so that blood isn't just pooling in their legs.
And can you also explain how being up helps the muscular aspect of the body and maintaining good muscle and its importance to overall wellness?
Yes. So along with like I was saying, when you're just laying down and not moving, your lungs aren't able to expand like they're supposed to. If you're not using your muscles, they deteriorate. Your body sees it as, oh, we don't need this anymore, so it's going to start breaking it down, because muscle takes energy. Well, if you're not using your energy, your body's like, well, we don't need this anymore, so we're going to get rid of it. And if you don't get rid of it, you lose it. And then if you do decide like, oh, one day I want to get this person up, you're not going to have the strength that you originally had, because those muscles have now atrophied. And that's a big issue from when patients have been laying down for a long time, or they haven't been using something, and then you try to get them up and get them moving. They don't have the strength that they did before, because you haven't been using those muscles. You have to constantly be using them in order to keep them going, to keep them working. So again, please get up, please move. Even if you're in the bed, like doing they call it passive range of motion, moving your arms, moving your legs, moving your body, like all of those help to work on those muscles, work on those bones, to get them moving and working.
Absolutely. And what about music therapy?
Yes. So music was another big thing that we use with Betty, and I've actually seen in clinical practice too, is that not only can it just be soothing for the soul. I mean, I think that we can all agree we love a good song, and especially when it's your favorite one, I feel like it just permeate something in you that's just like, let me turn this up. I don't care if I can sing or not, but I'm gonna sing it because it makes me feel good and I love this song. So again, not only speaking to the emotional factor of how engaging and positive it can be, but also like when it comes to pain, like it's a way to distract you, it's a way to work through your pain without having to use medications. It's a way to get your brain working. Again, if it's your favorite song, you're gonna listen to it, you're gonna want to sing the words. It's a stimulant. So yes, put your favorite music on for yourself, your loved one, whoever it is.
And music was a part of Betty's therapy?
Betty actually got me onto country music. I was not a country girl before, but there were some songs I was like, hold on, Betty, you might know a little something. So, and I literally still have those songs saved to this day. So, yes, country music was for Miss Betty.
Absolutely. And Aretha Franklin and Ray Charles.
Yes.
But we had her dancing every day, and at least twice a day. Morning.
Yep.
And
then in the
kitchen.
Yep. Oh my goodness.
Beautiful. So in your nursing curriculum, the aspect of psychology was addressed.
Yes.
And the importance of that in patient care. So can you explain what you were taught about psychology and therapeutics from that angle, and how that aligned with what we did for Betty?
So, I mean, of course, there's lots of avenues that you can go into with psychology. And then for Betty's care, I'll speak more to the fact of like anxiety and depression, because I feel like those are more of the aspects that we cater to with her. Of course, there's lots of many other avenues that we can go down with psychology, but it didn't pertain to her, so that can be for another video. But as far as ways that we helped with anxiety and depression with Betty is, again, I feel like it goes back to those patient-centered care that we gave to her, and making sure that we provided care not to just her diagnosis of dementia, but we also cater to the aspect of the anxiety that comes with it, the depression that comes with it, because there are moments of lucidity that your patient is going to realize, like, what is going on with me? Like, what is happening? And there were definitely moments that you could tell that Betty was literally like, what is happening to me? Like, what's going on? And she would get anxious, she would get nervous, and I'm like, just in that sense of like having that moment to be like, okay, like I'm like, something is wrong, and like I don't want to feel like this, but you do. Taking that time to like literally just like hold her hand and sit there with her and talk with her to let her know that someone was there with her and she wasn't by herself. Taking that time to put on her favorite music that she loves and would be songs that she would listen to, and those would be like some enjoyable moments for her. Taking that time to do her makeup and to do her hair, because that's literally what she got her degree in. She was able to help and to teach other people to give them those tools so they can make other people feel beautiful and good. And looking at yourself in the mirror and be like, ooh, I look good. And just like knowing that you're going throughout your day and feeling like your fullest self, knowing you got your makeup done, knowing you got your hair done, and nobody can tell you anything anymore. Taking the time to make her meals that she genuinely enjoys and is going to be soothing to her body and soothing to her gut. Taking the time to take her out to the mall and have her around other people and not just be stuck up in the house all day. So there's lots of things that don't require medications in order to actually, you know, lift your loved one up, lift your patient up. And it can literally be in the simplest form of holding someone's hand, or taking them out to do something, or giving them a warm bath and doing their makeup and their hair for them to make them feel put together.
Excellent. And finally, can you speak to the importance of oral care?
Yes. So kind of like what we were speaking to earlier, when we get sedentary, that can set the body up to get pneumonia. It can set up for atrophy, can set up for bed sores, it can set up for all those things because your body isn't moving. But another thing that you know, we don't really think about but actually plays a huge role into our health is oral. Your mouth is literally the gateway into the rest of your body. Other than your skin, your mouth is gonna allow for anything to come into there. So with our mouth, it's really, really important to make sure that our patients and our loved ones are getting oral care twice a day, because if not, again, it's a dark, moist place. Bacteria, like, we already have bacteria in our mouth, but when you're not properly getting rid of the stuff that you've been taking in throughout the day, you're just setting up for even more of a breeding ground in order for bacteria to grow. And that bacteria can either go down to your lungs and end up causing pneumonia, or bacteria can set up around the teeth that can cause an abscess. And once that abscess gets into your bloodstream, that can go to your heart, so it can affect that also. So it's so important to make sure that you are tending to your loved one or your patient's oral care, because it's not just, okay, this is just my mouth or my teeth. It's literally a gateway to the rest of your body that can cause issues.
Absolutely. So Betty,
and then it just also makes you feel good. Again, like, no one likes to feel like they have yuck mouth, so literally just take that time to brush your teeth, give them some mouthwash, wipe their mouth, and again, that in itself makes a huge difference in the way that someone feels.
Absolutely. And it's very affirming, going back to the psychology of the person, when their mouth is being taken care of morning and night, as was included on Betty's care plan. It is a signal to that person that they're being very thoughtfully and comprehensively cared for. So, well, very good. Well, Pilar, I just want to thank you for your dedication, your service to us.
Yes.
You were with us in the home. You were with us during the time when Betty was in memory care. You went to the hospital when she was in the final days of her life, and you cared for her in the hospital. You went through the complete experience, and for you to then go and become an RN so that you could learn even more, and to come back and to reflect and to see how so many of the bullet points that are covered in nursing school were being covered in Betty's care plan. And so it's valuable to me to have you come back and to express to our viewers the things that are important that can inspire them in caring for their loved ones. So I'm proud of you. I will love you and cherish you forever. And it was a God send that our lives intersected.
Absolutely.
A complete blessing. And so I would ask everyone to please like, comment, and share this video. And if you are in the position of caring for your loved one, I would say be encouraged and continue to tune in to that lady, Miss Betty, and her daughter, Shawn, as we continue to share information that will help you to be successful in caring for those that you love. Thank you so much, Pilar.
Thank you for having me.
Absolutely. Bye now.